Pilates has become a common way to exercise, but now it's being used as a physical therapy for children. We spoke with physical therapist Stephanie Gohman at Children's Hospital of Orange County and asked her to explain how Pilates is used this way.
Pilates is a series of exercise-based movements. It really concentrates on incorporating breathing into activating your deep core muscles, so your abdominals, your hips, your glutes. It was originally created by Joseph Pilates, and he originally called it Controlology. It works to activate your abdominals to stabilize your spine and your joints, and what that does is it puts your body in a more correct alignment to get optimal muscle contractions so that you have a more stable, strong spine. In physical therapy and Pilates for rehab, you're really depending on your therapist to assess the patient's injury or the alignment, and that can be how it's different from going to a Pilates studio and seeing a therapist that's trained to really focus on your body, your muscles, your injury, and protect and strengthen those areas.
We asked Stephanie Gohman who are the best candidates for receiving Pilates in rehab.
Pilates works best for patients that come in that have low back pain. Incorporating some of the research studies of our patient populations, we found that activating those deep inner core muscles before walking, before arm or leg movements, will actually provide more strength to the spine, reducing pain. It's not only for people who have low back pain or low back injuries, it can also be beneficial in teaching our athletes activate those deep abdominal muscles to strengthen their quads, the muscles in the front of the thighs, to strengthen their hamstrings or to strengthen their hips. It's providing them a stable base to then be challenged for a knee injury. We even use Pilates for ankle injuries, so there's a long list of conditions that could benefit from Pilates. Pilates for rehab will see patients that have neurological issues or have had a sports-related injury. Pilates for rehab is very specifically looking at so many different things, from breathing to alignment to correct activation of the deep abdominal muscles, and a therapist in an individual setting will be able to cue you to make small adjustments, especially while you're in the learning process.
What's the importance of having a physical therapist help patients with their Pilates rehab?
Having the therapist one-on-one, we have the ability to teach the patient to also learn body awareness and feel those muscles activate and work on the breathing and see and feel the expansion of the rib cage so that they know they're doing the exercises correctly and they can go home and reproduce them safely. Pilates can be life-changing for some people. Learning to activate those deep muscles and provide stability to the spine allows us to challenge our patients in more challenging ways, so we're able to get them stronger in ways that we haven't been able to before.